Ever wondered what prostate cancer is exactly and why it's so commonly heard of? Well, let's break it down. Prostate cancer is a type of cancer that occurs in the prostate, a small walnut-shaped gland in males that produces seminal fluid. It's one of the most common types of cancer in men. While it can be a serious disease, many men diagnosed with prostate cancer never experience symptoms, and due to its slow growth, do not die from it. However, certain types can be aggressive and spread quickly. That's why it's crucial to know about it. In the coming minutes, we are set to embark on a comprehensive exploration of prostate cancer. We'll cover its types, causes, symptoms, and diagnosis. We'll also discuss various treatment options and what life can be like after treatment. So, buckle up as we delve deeper into the world of prostate cancer. Prostate cancer, a term we hear often, but what does it really mean? Diving into the definition, prostate cancer is a condition that occurs when abnormal cells develop in the prostate, a small gland that produces seminal fluid in males. This gland, about the size of a walnut, is located below the bladder and in front of the rectum. It plays a crucial role in the male reproductive system. Prostate cancer is the most common cancer among men, aside from skin cancer. The growth of these abnormal cells can be slow or fast, but most cases are slow-growing. This means men may have prostate cancer for years without experiencing any symptoms. Understanding prostate cancer is crucial because it's not just a medical term, it's a reality that affects countless lives every day. Now that we understand what prostate cancer is, let's explore the different types. Did you know there are different types of prostate cancer? Indeed, diversity is not only the spice of life but also a characteristic of prostate cancer. The most common type is adenocarcinoma, making up about 98% of all prostate cancer cases. This type originates in the gland cells of the prostate. Now let's delve into some less common types. There's ductal adenocarcinoma, which starts in the cells that line the ducts of the prostate gland. Then, there's transitional cell cancer that begins in the bladder and spreads to the prostate. We also have small cell prostate cancer, a rare type that tends to grow and spread faster. Understanding the intricacies of these types is crucial because each varies in its aggressiveness and how it should be managed. The type of prostate cancer can influence the course of treatment and prognosis. Understanding the types of prostate cancer leads us to question what causes it. What triggers the onset of prostate cancer? It's a question that has puzzled scientists and medical professionals for years. And while there's no definitive answer, there are several known causes and risk factors. Age is one of those factors. Prostate cancer is more common in men over the age of 50, and the risk increases as a man gets older. Genetics also play a significant role. If your father or brother had prostate cancer, your risk of developing it is higher. Certain lifestyle factors can also contribute. A diet high in red meat and full-fat dairy products and low in fruits and vegetables may increase your risk. Obesity is another risk factor, as it can make it more difficult to diagnose and treat prostate cancer. Exposure to certain chemicals and substances, including some used in firefighting and in the rubber manufacturing industry, may also increase the risk. While knowing the causes is crucial, it's equally important to recognize the symptoms. How does one know if they have prostate cancer? It's a question that many people ponder. The truth is, early prostate cancer usually causes no symptoms. However, as the disease progresses, men may start to experience some signs. Frequent urination, especially at night, is one of the initial symptoms that men might notice. This can be accompanied by difficulty starting or stopping urination. Other urinary symptoms include a weak or interrupted flow of urine, or the need to strain to empty the bladder. Pain or discomfort while sitting, caused by an enlarged prostate, can also be a sign. Some men might experience bloody urine or semen, or persistent pain in the back, hips, or pelvis. Erectile dysfunction is another symptom that could indicate the presence of prostate cancer. However, it's important to remember that these symptoms could also be associated with conditions other than prostate cancer. So, if these symptoms are observed, how is prostate cancer diagnosed? Diagnosing prostate cancer involves several key steps. This process often starts with routine screenings, like a prostate-specific antigen, or PSA, blood test, or a digital rectal exam, during which a doctor feels the prostate for any irregularities. If these initial tests suggest the possibility of cancer, the next step typically involves a prostate biopsy. This is a procedure where a small sample of prostate tissue is removed and examined under a microscope to determine if cancer cells are present. Imaging tests such as a bone scan, computed tomography, CT scan, or magnetic resonance imaging, MRI, may also be used to help determine whether the cancer has spread beyond the prostate. These tests provide detailed pictures of the body's internal structures, helping doctors see the exact location and extent of the cancer. It's important to note that each individual's diagnostic process may vary based on their personal health history and specific symptoms. Once diagnosed, what are the treatment options? Treating prostate cancer is not a one-size-fits-all approach. Indeed, the variety of treatment options available reflects the complex nature of this disease. Let's delve into some of these options. For starters, there's active surveillance, which is often recommended for men with low-risk prostate cancer. It involves closely monitoring the patient's condition without immediate treatment, reducing the risk of side effects. Then, there's surgery. A radical prostatectomy involves the removal of the entire prostate gland and some surrounding tissue. It's a common treatment for men with localized prostate cancer, but it's important to note that surgery comes with risks, including urinary incontinence and erectile dysfunction. Radiation therapy is another option. External beam radiation uses high-energy rays to kill cancer cells, while brachytherapy involves placing radioactive seeds directly into the prostate. Both methods aim to destroy cancer cells while sparing healthy tissue. Hormone therapy is used to reduce levels of male hormones or androgens, which can stimulate the growth of cancer cells. While it doesn't cure the cancer, it can slow its growth and reduce symptoms. Chemotherapy, on the other hand, is typically used for advanced or high-risk prostate cancer. It involves the use of drugs that kill rapidly dividing cells, including cancer cells. Immunotherapy, a relatively new treatment option, uses the body's immune system to fight cancer. It's typically used for advanced prostate cancer that hasn't responded to hormone therapy. And finally, there's targeted therapy, which involves drugs that specifically target the changes in cancer cells that help them grow, divide, and spread. It's important to remember that the best treatment option varies for each individual, depending on factors like age, overall health, and the stage and grade of the cancer. Always consult with your healthcare provider to determine the most appropriate treatment plan for you. So, after all these treatment options, one may ask, post-treatment, what does life look like? Let's move on to discuss that next. Life after treatment for prostate cancer can be a new journey altogether. The road to recovery can be challenging, yet it's often filled with hope and resilience. After treatment, your body may need time to heal, and this healing process varies from person to person. Some may bounce back quickly, while others may need a bit more time to regain their strength. In this phase, it's crucial to maintain a healthy lifestyle. A balanced diet, rich in fruits, vegetables, and lean proteins, can aid in recovery. Regular physical activity, such as walking or yoga, can also be beneficial. It's important to listen to your body and give it the care it needs. Emotionally, it might be a roller coaster ride. It's perfectly normal to feel a wide range of emotions. Remember, it's okay to seek help. Whether it's from a professional, a support group, or loved ones, reaching out is a sign of strength, not weakness. Prostate cancer is a complex disease, but knowledge is power. Let's take a moment to recap what we've learned today. We started our journey understanding the basics of prostate cancer, a disease that primarily affects men, especially as they age. We then delved into its various types, highlighting the most common one, prostate adenocarcinoma. We discussed the causes, stressing that while the exact cause is unknown, certain risk factors like age, family history, and race can increase the likelihood. Symptoms were next, where we pointed out that early stages may not show any signs, but advanced stages could lead to discomfort or changes in urinary habits. We learned about the process of diagnosing this condition through methods like PSA blood tests and biopsies. Then, we explored the various treatment options, from surgery to radiation, hormone therapy, and chemotherapy. We also touched on life after treatment and how it's possible to lead a fulfilling life post-diagnosis with the right support and care. Remember, early detection is key. Stay informed, stay vigilant, and stay healthy.